Robot-assisted gynecological surgery is when we use the robotic console for performing the procedure in the pelvis for gynecological cases. So it's a form of laparoscopy, but the instruments are held by a robotic platform that keeps the camera dead still, the instruments without any shaking movements, and that gives you this high precision. But in a sense, it is a form of laparoscopic surgery where the procedure is done through small incision in the belly, which gives us the advantage of faster recovery and quicker return to normal activity. The difference, though, from laparoscopy, even though the small incision on the outside, is because of that very stable camera. We're talking about 5 times high definition 3D vision of the robot, which gives you that sort of depth perception with high definition view. It gives you much better precision. You're working close to very delicate structures. You have way more confidence that your shaky hands might not cause that injury when you're doing that very delicate dissection. And the easiest way I can explain how different it is imagine if you are driving your car with one eye closed. That sort of depth perception that you feel like you're not quite as confident about your limits, this is exactly what I'm talking about. When you go in under the 3D impression, where you're seeing the depth perception and dead still camera, you are completely still, and everything else that's moving is much easier. It pops out from the camera for you, and you can see where the blood vessels are. Those very small blood vessels that are usually difficult to find, when you are in the robotic console and you can actually see them. It comes to life where you have to stay away from what it is that you have to control. So it makes surgery much more focused and patient-centered and much more precise. When we talk about advantage of robotic surgery for the patient and the surgeon, the easiest way to summarize it is by going through what we call the quadruple aim. In healthcare, every time we introduce a new technology or procedure, we like to make sure we check the boxes for this quadruple aim. One, we want to make sure that we are able to provide better patient outcomes. And when we talk about robotic surgery, when we can do complex surgeries through a minimally invasive approach where patients go home the same day, then we know we are providing better patient experience and better outcomes. The next thing is this providing the patient with a better experience, return back to work sooner, being productive sooner, tackling complex pathology with a minimally invasive approach. The third aim is to make sure that this is lower cost. And even though the robotic console does have a higher investment in the first place when we start the introduction of the robotic surgery program, but what we do believe is when we have these surgeries done by efficient providers, highly skilled nurses, appropriate patient selection, where we can sort of bring back the cost to be lower by offering this difference between doing a complex procedure through a minimally invasive approach where the patient will go home the same day, and so that cost of staying at the hospital for 3 to 4 days, the complications that might happen from a open procedure, all that factors into the cost. We don't want to just talk about the cost of the procedure, but what are we shaving down the road when we provide this type of advantage by offering a minimally invasive approach with the robotic surgery. The last, which I think robotic surgery did knock it out of the park, is when we provide a better clinical experience. And what that means, not only the patient is getting the advantage of higher precision and shorter, smaller incisions and shorter hospital stay, but the team that is taking care of the patient, the surgeon and the nurses, most of the time they are sitting during the whole 3-4 hour procedures. And those can be quite taxing on our body from an ergonomic standpoint. Much less risk of musculoskeletal injury, the provider's perception, the surgeon's perception and concentration and fatigue is much better when you are doing the robotic procedure. So if I have a day where I have 4 procedures, I know I can deliver the same excellent experience, precision, and competence throughout the day and not feel like I'm sort of, my ability to provide excellent care and excellent precise surgery is decreasing and dwindling towards the end of it. That is huge from a patient safety perspective. The type of GYN surgeries that we can do robotically, we can do anything robotically. If you can do it laparoscopically, it can be done robotically. But because this is a very high-tech technology, we would like to use it for what we think is complex. So we tackle the hysterectomies with it, especially those that have bigger uteruses that can usually need to be done with an open approach. The robotic does help me take care of big fibroid uterus, for instance, through very small incisions, which patient can go on the same day. The second thing is myomectomies, treatment for fibroids. Some patient will need their fibers to be removed. The robot has wristed movements, so it's not a straight, rigid stick. It has wristed movements, so it can actually sew and control the bleeding much efficiently. So that's why fibroids can be done robotically as well. Endometriosis, that is a disease that can really be infiltrating into very delicate structures like the ureters, like the vessels or the nerves. And when you have this wristed body movement, you're not taking any shortcuts. You're doing the dissection as it is and trying to keep those vital structures safe by having this very high, almost microscopic surgery type of approach.